Hello. Hi, everybody. All right. I am getting on here like 1 minute early, but I'm gonna take some time to try to share, tag and share, and I encourage you to do the same. I'm gonna wait a few minutes to see if I can get some people on here as well. So I hope y'all are having an amazing day. I really do. Let's see. Maybe I can do it from my computer while I'm waiting for some people to pop on. When you do come on, please say hi. Please put something in the comments so that I know that you're there. And I'm going to try to share this thing. All right, let's see. Here we go. Do. Boom. All right. I see 2 people have jumped on. Comment, say something, say, hey, y'all. I'm excited to talk about today's topic. What is a pharmacist? It's me. It's my passion, and it's what I do. So I'm hoping and praying that you guys will get something out of it. A lot of people have some misconceptions about what a pharmacist is. So if you could do me a favor and tag, and share this live, I'd appreciate it. And we're going to get rolling in just a little bit. Hello, Carlton. How you doing? Hope you're having a great day. Let's see. Lord. Hey, Apostle Kirk. All right. Hopefully this will help. I'm so happy to see y'all on. Y'all got to excuse my voice. I'm kind of fighting this crud along with everybody else around this time of the year right now with the weather going back and forth. So excuse the hoarseness, and I will try to get through this as best as I can. So my name is Dr. Ravin Milton, PharmD. For those who don't know me, I am a pharmacist, and I've been a pharmacist for over 20 years. I graduated in 2001 from the lovely Xavier University of Louisiana, and I've been practicing in community pharmacy mostly, but I have also practiced in long-term care pharmacy. I have taught a pharmacy technician program, and I've done a few things here and there. I've hosted vaccination clinics. I have done medication therapy management programs. So I've done a little bit of, along the years, and I am grateful to be in this profession. So I'm here to bring you information that you didn't know that you needed to know, because there are misconceptions in this world of pharmacy. So I figured, hey, let's get all the info out there that you really need to know, that gets you to prosper, that gets you to grow, that gets you healthy, that gets all the things for you, right? So I am going to, start right here. Let's see. Okay, here we go. Thank you, Apostle. Nothing sounds bad in my voice, so thank you. It feels like it does. So, oh my goodness. So what is a pharmacist? That's a really good question. We have pharmacists all over this nation, all over the world. And, people have this misconception about pharmacists because of what they see in front of them. But the pharmacy is so vast that there are so many of us, right? So the Merriam-Webster dictionary defines us as, and I say us because I'm a pharmacist, so I claim it, right? A pharmacist is a healthcare professional, and we are licensed to engage in pharmacy with duties, including dispensing prescription drugs, monitoring drug interactions, administering vaccines, and counseling patients regarding the effects and proper usage of drugs and dietary supplements. So, I like that definition because it actually is very well-rounded as to what we do in the field. And there's one misconception that some people may have, and it says, gotta love when people call during your life, huh? It says that pharmacists are simply those that dispense the prescriptions that your doctors prescribe to you. You walk into a pharmacy, your doctor has sent your prescription over to the pharmacy, and they give you what the doctor says on the prescription, and that's it. Nope, that's not what we do. So before that prescription gets in your hands, what we have to do is look at the prescription, look at the dose of the prescription, look at that everything is correct on the prescription as far as what would normally be prescribed under regular regulations, because there are guidelines that have to be followed when prescribing medications. Most people don't think about that. They think, hey, my doctor wrote it. They know, they know what to write for. They're going to write the right thing, and, so forth and so on. And majority of the time, that is the case. Majority of the time, that happens. But there are those instances where a patient has an allergy and the doctor didn't catch it when he prescribed this particular medication. Who stops it? We do. We either call the patient, say, hey, are you really allergic to this medication? Because that's what it says on your profile. Or if there is a true allergy there, we call the doctor and say, hey, patient's allergic to XYZ. What are you treating? Maybe we can suggest something different. Or just a straight up, hey, they're allergic to it. Would you prescribe something different? So there are things that pharmacists do for you behind the scenes that you don't really get to see. If you would break down what our duties actually are, dispensing prescription drugs is like base level of what we do. It is like the bare minimum of what we do. And although some people will think that we like to, we could just slap a label on it. No, it don't really work like that. We take care in dispensing our prescriptions. We monitor what you're taking. We also monitor drug interactions. So say your doctor sends over, and I'm going to just go through kind of the duties on how this definition breaks down, because I love this definition. So it says monitoring drug interactions. You say you're on one medication and you end up going to another doctor, and the doctor gives you a prescription. This other doctor gives you a prescription, but they have no idea that you're taking this other medication. There could be a drug interaction between the two that will be harmful to you. If you go to the same pharmacy, and I advocate that you're using one pharmacy and one pharmacy only, it allows you to get to know your pharmacist, and your pharmacist will know what you're taking. If you go to one pharmacy, that pharmacist can look at your profile as they're typing it and go, hey, that's not a good combination. We need to call this doctor here who prescribed a new drug and let them know that you're taking this other drug, because it can be harmful to you. And here's the thing. We take an oath to do no harm. When we graduate, just like the doctors, when we get licensed and we walk across that stage, after getting our degree, we take an actual oath that says we do no harm, which means that anything that crosses the screen for us, we have to make sure that it's not doing you any harm. Because what's the point, right? What is the point of you coming to the pharmacy to get something that's supposed to help you, but it actually harms you? That can go so many ways, and there's so many things that can happen if we don't screen prescriptions properly. So that's part of the information that I would like you to, just keep in mind. And when you're bringing your prescriptions, when you're going to pick your prescriptions up, there can be drug interactions. There can be, like I said, adverse reactions sometimes to medications. You may have not necessarily a allergic reaction, but you may have an adverse reaction because of something else that you're taking that may cause you to need to take something else. We try to minimize those. If we can find any way to minimize the amount of medications that you're taking, then that's what we are there to do. Administering vaccines. This is something that started happening well after I was practicing for a while, but flu shots came on the scene. They were going hot and heavy. Doctors' offices were overloaded with the amount of vaccines, and they pushed that towards pharmacists. So now I don't know if you would actually recognize that when you go to your doctor's office, let's see. I will answer that question in just a second, Carlton. So when you go to your doctor's office, it's hard to get a vaccine from them. They'll push you towards the pharmacist. We are the ones for point of care for vaccines now, unless it's a pediatrician office. And they typically will take care of the children's vaccines. But if you're an adult, majority of the time, you are going to get your vaccines here. Hey, Dr. Robinson. I have Dr. Sabrina Robinson who just logged on. She graduated with me from Xavier. So your question, Carlton, is does the patient's profile come up no matter who their doctor or health provider is? No. That's the importance in that is the importance in you using one pharmacy, because we can't see your profiles from your doctor's offices. We can't see everything that you've been prescribed. As much as I would like our electronic health records to merge all into one, we have no way in the pharmacy of seeing all of that unless your insurance flags it as an interaction and say, hey, this patient is taking this medication. And we have to put an override in to say that we know that you're taking the medication, or you might tell us, but 9 times out of 10, we don't know if you're getting prescriptions filled at another pharmacy, which is not really a good thing, because there's so many things that can happen when we don't have all the details in front of us. So I'm just going to say, please, please, please try to use one pharmacy. I know that it is hard to get some of your medications at some of the pharmacies nowadays. We've got all kind of things going on with back orders, but please try to stick to one pharmacy. It's a good thing to do. One, it keeps all of your medications in line so that the pharmacist can see everything that you're taking. They have the full picture. When the full picture is before them when they're looking at that new prescription that's coming in, or even that refill that they're doing. They can see when your doses go up, when your doses go down, and they can counsel you as such. But if you hop from pharmacy to pharmacy, you're putting yourself at risk, because that pharmacist can't see it all. We don't have the full picture in front of us, and it makes it harder for us to care for you. So that's just something to keep in mind. In addition to administering vaccines, we also counsel our patients. Now, listen, I will be honest. Pharmacists are under a lot of stress right now. They are under a ton of stress with all of the responsibilities that we've been given since we started administering vaccines. And I'm talking, we're doing COVID clinics, we're doing test to treat. There are some pharmacists that, test for, that will test for strep and flu, and they're allowed to, give you a prescription based on your state. They're allowed to give you that prescription based on whether or not you test positive. We are under a tremendous amount of pressure, and many times we are short-staffed. We're working on skeleton schedules, and a lot of us are working throughout the day without breaks, without having the opportunity to go to the restroom, without having the opportunity to sit down and just eat and breathe. So please, please, please be patient with your pharmacists. And they are trying to do their best with the situations that they have been given. And counseling is one of those things where you might just get a short version of a consultation because the pharmacist is in a rush because they've got a lot to do. There's so many responsibilities on us when we're in that pharmacy, and sometimes we're there by ourselves, having to man the fort and answer phone calls and talk to doctors and counsel patients. So that consultation may be rather short. Have patience. That's my request. But also advocate for yourself. Ask the questions that pharmacist may not answer when they're going through, the rundown of your medication. Please just take the time and say, hey, I have a question. And 9 times out of 10, they won't deny your question. They're just under a huge amount of pressure. So just keep that in mind when you're picking up your prescriptions. They may be, a lot of, I don't know if y'all seen it in the news, but there's been a lot of pharmacists that have actually been quitting because the stress is too great. We've had pharmacists that I've heard of commit suicide. We've had pharmacists have heart attacks in the pharmacy. There's a lot going on with your pharmacist, so please pray for them. Please. We pour out a lot, and many don't know it. So people think that money is the cure of everything. Oh, you get paid to handle the stress. No. Pray for your healthcare providers, because at the end of the day, if they are not well enough to take care of you, who takes care of you? Sorry, I had to. When Holy Spirit tells me to address something, I address it. And that was just something that he had to put on me just now. So I just want to unction y'all. So please pray for your healthcare providers. And I'm talking doctors, nurses, pharmacists, all around in healthcare. They're under a tremendous amount of stress. And we need your prayers. We need your thoughts. We need you to care. We need your patience. We need your mercy. So thank you for that in advance. And I'll move on to the next thing. So we counsel our patients, and when we do counsel you, we talk to you about what the medication is for, what the side effects are of that medication, what you may, what to look out for, how long you're supposed to take the medication, what you need to look out for if your medication is not working, things like that. So those are just an introduction of kind of what a pharmacist does. Now listen, here's the difference between a pharmacist and a physician. Your physician writes your prescription based on you presenting to their office and what your ailment may be. The pharmacist is the one who knows what's the best treatment for that ailment. Now, this is not to say that your physician does not know what the best treatment is, particularly for you as their patient. However, there are guidelines out there for different disease states that we follow. That may be different for some people. Doctors might have to go off of the guidelines, we call that off-label uses of medication. But for the most part, there are guidelines for every disease state on what medication to take and when you max out a dose and so forth and so on. Pharmacists are here to help with those guidelines. And we are not there to prescribe, which a lot of doctors may think, or a lot of people may think, well, we're trying to prescribe, when we call them back and say, hey, this doesn't quite look right. No, we're not trying to prescribe. We're trying to optimize treatment. I guess that's the best way to put it. Your pharmacists go through at least 4 years of pharmacy school now for most of those PharmD programs. So we have what's called, our degree is a doctorate of pharmacy. What that means is that we go through 4 years of graduate school after either 2 years of pre-pharmacy or 4 years of a bachelor's degree. Once we get into pharmacy school, our training and the classes that we take, they are specialized towards the medicine and specialized even towards the body. We take classes such as human anatomy and physiology. Doctors take that, right? They have to. You have to know what the body is, and how medications affect the body. There goes in pharmacology. That's how medications affect the body. We take pharmacy calculations because, listen, there's a whole new world called pharmacy math, and it is different from your regular math. So when we are looking at the doses for a patient medication, there's some pharmacy calculations that go on there. So we have that course. There's biochemistry that goes along with the anatomy and again of the body, speaking to your amino acids and that are in your body and all of these other things. We take therapeutics, which is, what is the right therapy for this disease state? And we cover all of the disease states. We don't pick and choose when we're learning. We have to know them all. There's medicinal chemistry. That is the actual structure of the medication. Listen, we learn a lot in those years. It is not for the faint at heart. Medicinal chemistry is like you actually are tested on what the actual chemical structure of a medication is. And I'm not just talking H2O. I'm talking a whole bunch of different chemicals and the structure and having to draw them out. Listen, it is not an easy task. We have epidemiology. These are, some of the things that are being, epidemiology, things like that are being brought to the forefront now and being taught to our current pharmacists and pharmacy students. Pharmacokinetics, that's learning how long it takes for a medication to move through your body. How long does it take for it to have its effect on your body? How long does it take for it to be eliminated? What's going to stop that elimination from happening? What speeds up that elimination? There's pharmacy law. There's pharmacy management. Listen, we go through training when it comes to your medicines. It is not something that we just go to school to learn how to slap a label on a bottle and put some pills in there. There is detail upon detail upon detail of this stuff. So I just want y'all to understand that there's some training that goes on in this field. We are highly trained professionals, and yeah, our brain was tired going through it too. And on top of that, y'all, we have a national exam that we take just like the physicians. Hey, T-Net. We have we have an exam that we have to take within a certain amount of time, and it's called the NAPLEX. It's a very detailed exam that tests over all of this information. Listen, when I got licensed, I was pregnant with my daughter when I took that exam. I walked out of that exam bawling. I mean, crying, because I just knew. I knew I failed that thing. When I got my results that said that I passed, there were tears of joy. But just imagine being pregnant and having to go through all of those emotions of did I pass? Did I not pass? It's a lot of information, y'all, and it can be very, very stressful. Yeah. So there are some synonyms for pharmacists, right? So listen, if you hear an older person say druggist, that was the old terminology. The new terminology is pharmacist. Some of our elders say druggist. They'll say overseas, they say chemist. And this very ancient word is apothecary. So what my son loves to call me, and I crack up every time he does this, my son calls me a legalized drug dealer. I can't argue with it. It's the truth. I am a legalized drug dealer. I mean, technically, we exchange drugs for money. So, just the legal way. So, I can't really be mad at him, but I kind of, nudge him. Don't say that. Mom's a pharmacist. I've always been a pharmacist. I'll always be a pharmacist. Yes, they still say druggist to this day, Carlton. A lot of my older patients that come in, they're in their 80s, 70s, and 80s, and they're like, where's the druggist? And I'm like, hi, I'm the pharmacist. How you doing? I don't want to have the thought of me drugging somebody. It's such a bad connotation. But as pharmacists go, pharmacy has kind of always been there. It's always been around. The first actual prescription dates back to, hey, Paul. Hey, Prophet Paul, how are you? The first prescription dates back to 2100 BC in Mesopotamia. They found a prescription written on clay tablets. So if you think about it, pharmacy has always been around. There's always been the mixing of earthly ingredients that they've found to have some type of medicinal properties. All of the medicine that we have, for the most part, come from some type of earthly base that's already been there and has grown through technology, right? So if you think about aspirin, that's like, hey, Joy. If you think about aspirin, that's something that is salicylic acid. Is something that it comes from all of these natural things. There are so many natural medications that are available, and pharmacists came along throughout the years and just started putting these things together, being true chemists and compounding them. And if you had an ailment, you went to your local pharmacist and asked for something to help with whatever you were going through. A lot of times they would actually mix it up in their, pharmacy. It wasn't until, 1938, y'all, is when they actually started regulating the medications that were having to be approved. So before then, you could go to a local pharmacy. Before then, there were like soda shops, things like that. You could go to that pharmacy and say, hey, my wrist hurts, or I pulled a muscle, or something of that sort. And pharmacists would either mix up something for you to take, give you something to drink, give you your complete instructions, all of your counseling right then and there, and you had your prescription. Isn't it interesting? It is. Hey, Marion, happy Wednesday. Isn't it interesting that this is something that's been here forever, feels like it. I mean, we're talking back 2100 BC. Listen, that's 2100 BC. Think about that. We're in 2024. 2100 BC is when we saw our very first prescription on clay tablets. God has always given us a way to help with the ailments that we've had. There's always been physicians, there's always been pharmacists, and there's always been a natural path to healing. It blows my mind when I think about it. It absolutely blows my mind that God would give us everything that we needed, even as far as back then, right? So pharmacists used to do all of the above, and it wasn't until about, 1240 AD that there was a European ruler, King Frederick II, that's his name. He separated a physician from a pharmacist. He separated our roles because, we were pharmacists, essentially were physicians. You were the one that they went to. Hey, Elder B. They were the ones that you went to get your treatments. So herbal medication has always been around. Herbal treatments have always been around. They are effective. You do not always have to get a prescription. To answer your question, yes, I do advocate natural and herbal medications. If you can get by with like turmeric for inflammation versus having to take an ibuprofen, that's safer and more natural than doing an ibuprofen. Now, listen, I said this before and I'll say it again. Anything that you enter into your body that is not naturally in your body will have some type of a side effect. It will have an effect and a side effect. So don't think that if you take a medicinal or a natural medicine or an herbal medicine that you won't have to worry about those and you can take those all willy-nilly. Please still talk to your pharmacist about those as well. That's what we're there for. We don't get as much training on or at least I didn't. I know for us, we had one OTC class, a huge book to go through, but we don't get that in-depth training on natural medications as we do on the therapeutic ones that are prescribed. There are some pharmacists who make it their track in life to be that type of pharmacist where you learn all the nutritional, the nutrients and things of that sort, and they kind of stay away from the prescribed stuff. They're natural pharmacists. That's okay. That's actually awesome. I want to keep you out of my pharmacy just as much as anybody else. Now listen, just because I'm a pharmacist doesn't mean that everything that I want you to take is supposed to be something prescribed by a physician, because that's not always required. Sometimes it's a healthy diet. Sometimes it's exercise. Sometimes it's something natural that's over the counter, like your vitamins and your minerals. Sometimes it's just getting out in the sun and getting that vitamin D from that source. Sometimes it's going that homeopathic route, that natural route, versus doing everything, going to your doctor and saying, hey, give me a script. It does not always take that. And be okay with not always wanting to go that route, and be okay with challenging your physician to ask for a more natural route if that's what you want. Because at the end of the day, it is your body, you are the one that has to take the medications. At the end of the day, you are the one that has to deal with the side effects or with the treatment plan or whatever that is. Be involved in your own treatment plan. I implore you to be involved in your parents' care. be involved in your children's care. Be involved in your own care. Don't just take something just because they say it to take something. If you got a question, ask. You have every right to ask a question. You have every right to say, no, I'm not comfortable. You have every right to say, this doesn't sit well with me and I'd like a second opinion. You have that right, because at the end of the day, it is about your treatment and your care. Okay, so this is kind of where I'm going to stop. There's so many things that I could talk about when it comes to pharmacists. And you know what? I'm going to add on one more thing. So there are different types of pharmacists, right? There are actually over 100 positions of a pharmacy when it comes to pharmacists. There are ambulatory care pharmacists. Those are your pharmacists that work closely with your doctors in the doctor's office. There are cardiac pharmacists. Those are the pharmacists that know in depth about the heart and what types of medication help the heart. They are often in the hospital rounding with the cardiac team. There's community pharmacists. That's me. That's what I do. I'm out there at our local pharmacy here in Cleburne. Shameless plug, Royce's Pharmacy, if you want to pass by. And we are the pharmacists that fill your prescriptions when you get one. We're filling your maintenance medication. We're catching your drug interactions. We're doing your medication therapy management, which is pretty much going over all of your medicines to make sure that everything is on the up and up. There are compounding pharmacists. When there are medications that are not available to readily, like we can't order it from a manufacturer, say a different dose. There are pharmacists who actually compound those medications. Some say something is not available because it's on back order. Hey, T-Net, I'm going to call you about that. There are pharmacists who are compounding because things are not available and they're on back order. Compounding pharmacists fill a great need, and they know a lot, you know. So there are geriatric pharmacists. Those are your pharmacists that deal with your elderly. Their elderly patients are on so many different medications. I can remember my grandmother on my mother's side when I first got into pharmacy school, you know, I sat down and I can remember being at her table with my aunt and going through all of her different medications. She was on 20 plus medications, not including insulin. These seniors have been overprescribed so many different medications, and there are pharmacists who see to make sure that these elderly patients are not being overprescribed. They try to get their medications down to a minimum. There are hospital pharmacists. Every hospital, I'm not going to say every hospital, but most hospitals have a pharmacy where they get all of their medications from the basement is in most positions. But then there are also outpatient pharmacies in the hospital where you can get a prescription filled just like you would at a community pharmacy. There are infectious disease pharmacists who know all the details, all the ins and outs about infectious diseases and which medications would be best for this particular disease state. There are nuclear pharmacists. Those are the pharmacists who make your chemo drugs. They make drugs that are based on the type of cancer that you have and based for your body. They take on a lot of risk in coming in contact with these radioactive medications. There are oncologist pharmacists who help with the treatment plans of cancer. There are pediatric pharmacists who know, because oh my goodness, the pediatric pharmacists, they take on the care of your little ones, because the bodies of a little kid is so different from an adult, and dosing is so different. We have pediatric pharmacists that know the ins and outs of all things pediatric care. There are industry pharmacists who help do the research to get these medications on the market. There are poison control pharmacists. Listen, we are everywhere. We are everywhere. There are poison control pharmacists. When someone has a child that has accidentally gotten into their vitamins and taken too many of those gummies, this is the place that, that parent is going to call and say, hey, it's a poison control center, and my kid just got into all of this medicine. What do I do? And they give them direct information. Every state should have a poison control center. If you didn't know that, every state has one. There's psychiatric pharmacists who deal with mental health and all of those medications. There are even veterinary pharmacists that deal with your animals. We are everywhere serving you. And I mean everywhere. So I'm going to answer, a couple of questions before I hop off, because I really don't want to take up all of y'all lunch. Can you compound to meet insurance guidelines? Yes, there are insurance guidelines where insurance will cover compounds. It just depends on what you're being compounded. Most insurance companies will pay for compounds. I haven't seen that many that won't, but as long as you're within the guidelines and within like a certain kind of not necessarily prescription, but a certain formula, I should say. Within that formula, it should be covered by the insurance. I know our particular company, when we have a particular compounding pharmacy in Fort Worth, that's all they do. They don't do anything else but compounds. And they don't bill the insurance, but they give you the paperwork in order to get your prescription covered and be reimbursed. There are some, compounding pharmacies that handle it that way. And then there are other compounding pharmacies that bill your insurance straight up. So I hope that this has been informative to you. I hope that I haven't overloaded you with 10,000 different things. I know it's a lot. I hope that you got something out of it. But most of all, I pray that you will see your pharmacist in a different light. That you will see us as those who truly care about you, who truly care about getting your medicine to you, getting you the counseling that you need, getting you the care that you need, and that you would feel free to ask questions, feel free to even talk to your doctors about any questions that you have. I appreciate you taking the time to come on here with me, this second installment of RX Info on the Go. If you couldn't tell already, I'm super excited about this. And I just pray that I'll be able to give you more and more information of what you need, because that's the goal here, right? The goal here is for me to give you information that you need, not something that you can just Google, but the real ins and outs of what you need to take care of yourselves and have a better life, a better quality of life, right? So thank you so much for tuning in. I appreciate it. I hope y'all got something. If you have any questions, as always, feel free to inbox me. I have no problems with answering questions. If you inbox me and I don't get back to you quickly, I apologize. I will get back to you as soon as possible, because if you're not a Facebook friend, I don't see your message right away. It kind of goes off into spam land. Also, if you have a specific question, sometimes it takes a little bit of time for me to do research. And I also work full-time as a pharmacy manager in addition to being a mom of a very active 14-year-old. So, and I'm active in my church. So I have a busy life, but I'm still here to get the information that you need. That is the whole purpose of this. So give me a little grace on time and I'll get back to you as soon as I can. Thank you so much for tuning in, and I will see you guys next week on Wednesday for more RX info on the go. I think, let's see, what's going to be the topic for next week? Okay. Following instructions. That's what's going to happen next week. The importance of following instructions. So join me next week. We'll dive into following instructions. And this has been RX Info on the Go. I love y'all. Y'all have an amazing day. Later.